Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about a medication known as chlordiazepoxide. Its brand name is LIBRIUM. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So chlordiazepoxide is actually a benzodiazepine prototype which has anti-anxiety, sedative, appetite stimulating, and a weak analgesic effect. To this day, unfortunately, there is still no exact mechanism of action that is known. So there are a couple different indications of when you would use chlordiazepoxide. One would be treating alcohol withdrawal syndrome. It can be used to treat anxiety, and it can also be used to treat preoperative anxiety before somebody has a procedure. Before an individual was to use chlordiazepoxide, there are some warnings and precautions that they should be made aware of. So this medication is on the Beers criteria, which is the list of medications that the elderly population must use cautiously or avoid. This population would be at an increased risk of cognitive impairment. They may experience delirium, and falls, fractures, and motor vehicle accidents would be a concern as well. The use of chlordiazepoxide with other psychotropic agents is generally not recommended. It must be used cautiously in patients who have porphyria, as an exacerbation may occur. An individual's mental or physical ability to perform hazardous tasks, such as driving an automobile or operating heavy machinery, may be impaired while using this medication. The risk of this would be increased if a patient was using this medication with alcohol or other medications that can cause CNS depression. Paradoxal reactions, such as excitement, stimulation, or acute rage, has been noticed in psychiatric patients who use this medication. This has also been noticed in hyperactive, aggressive pediatric patients. Monitoring would be required in these situations. Healthcare professionals must use caution when using this medication to treat anxiety in individuals who have depression, as this may increase the risk of suicidality. This medication can cause congenital malformations, so it should not be used in the first trimester of pregnancy. And finally, barbiturate-type withdrawal symptoms have been reported upon discontinuation of this medication. Once somebody is made aware of the precautions and warnings and they start using chlordiazepoxide, they can expect to take this medication in capsule form. It's available as a 5, a 10, as well as a 25 milligram capsule. When treating alcohol withdrawal syndrome, usually we would start off giving patients a dose of 50 or 100 milligrams, and then this dose can be repeated as needed depending on symptom severity, up to a max dose of 300 milligrams per day. Once everything is under control, the dose would be decreased and given at a maintenance level. When people are using this medication to treat mild or moderate anxiety, they can use 5 or 10 milligrams 3 or 4 times daily. In cases of severe anxiety, 20 or 25 milligrams can be given 3 or 4 times daily. If somebody is using chlordiazepoxide to treat preoperative anxiety, they can use 5 or 10 milligrams 3 or 4 times a day just for the few days before the procedure. Now, as with most medications, there are some adverse reactions or side effects that people may experience while they're taking chlordiazepoxide, so I'll list some of those here for you now. Edema or swelling happens in some people. Some patients experience constipation or nausea. In terms of neurological side effects, some patients experience ataxia or confusion, while others experience somnolence. Females who use chlordiazepoxide may notice irregular periods. And both males and females may notice a change in their libido. Agranulocytosis would be a rare and serious side effect of chlordiazepoxide. And lastly, and rarely, people do experience a decrease in liver function. That's all we're going to talk about today with chlordiazepoxide, or LIBRIUM. As always, I'm thankful that you took the time to come by and watch one of my videos. If you found the information valuable and you're willing to help me grow this channel, you can do so by liking the videos, sharing the videos, and subscribing to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.